right, thank you, Steve. Texas Governor Greg Abbott wants to drop the hammer on politicians to stop sanctuary cities in a new bill that he's proposing, booting local officials out of office and charging them with crimes if they refuse to deport illegals. Texas Republican Congressman Michael Burgess joins us now to react to this. Good morning to you, Congressman.
Good morning. Thanks for having me on.
You're also a medical doctor, so do you prefer doctor or congressman?
Well, doctor does poll a little bit better than congressman, so Mother always called me doctor.
Are wrong.
Well, the polls may be rigged. You may be correct.
Okay, well, so what is your opinion about this, that your governor wants to do this?
Well, clearly I support my governor. I have constituents who've come in to talk to me because of problems that they have had. Governor is on the right track. Obviously, the replacement of a public official is up to the voters of that area, and surely that may well become an issue in municipal elections that are coming up in May.
They could actually sue the local government, because Kate Steinle's family tried to do that in California, and they were not successful.
So that would be a change in state law, and obviously up for the legislature to consider that. Okay,
let's talk about Obamacare, because you are the longest-serving physician in Congress right now. How many physicians are there?
I think on the House side, 15 or 16, and obviously you got 3 over in the Senate.
Okay, so Obamacare, you're for repealing, replacing?
Never for Obamacare, ever. Look, if I ran things, which I don't, I'm a simple, humble member of Congress, but if I ran things, the individual mandate is the first thing that I would displace. It has no place in a free society. It was never correct for the federal government to say we're going to cause you to buy something and then regulate it under the Commerce Clause because we've caused you to buy it.
So are you for repealing and not replacing?
For the individual mandate, it needs to go. Yeah, people need to have health insurance. It's a responsibility, not a right. It's a responsibility. People should want to take care of themselves and their families. I want that as a physician, but I know that mandating it, look, we're all mandated to pay our income taxes, and what's the compliance rate with the IRS? It's about 85%. So we still have 15% who don't even function under that very severe mandate.
What's the timetable? The president said maybe a year.
The repeal of the bigger pieces of the Affordable Care Act is likely to happen under that Senate reconciliation rule that only requires 51 Senate votes to get it through. I think that will come through the House early March, late February. The Senate will have their own timeline on that, and that will actually set things in motion for repeal.
All right. Dr. Burgess, Congressman Burgess, thank you so much.
Thanks for having me on. I appreciate it.